Hi everyone, my name is Dr.Mazhar and today I just would like to talk about how to taking the history of a patient. So history taking format today I would like to talk about, because nowadays many medical students in their during their prof they feel very difficulty that how to take the history. So I just think that I have to make a lecture on this topic. So it's a very important for those who are studying MBBS or who are in house job or who are doing in their fellowship, because history taking is going throughout the life, throughout your profession. So first of all, I would like to talk about how you take the history of patient. So history taking start from the basic demography or basic introduction of the patient, including patient age, including patient sex, including patient status, either patient married or unmarried. Patient occupation is very important in history taking, and then patient age and from where patient came, from what's the source of patient coming from the admission, like he or she came from someone clinic or through medical OPD or emergency. So this is like a source. So this source, this step by step, their name, what is the name, what's the age, what's the sex of patient, what's their occupation, and from the source. So this we call demography of the patient. That when you take the history in the hospital setup, so you will see many patients in the OPD they written that, for example, for any name you can say that age 45, come from which region, from village or from city. So that's the thing, this we call demography of the patient. Then we will talk about the chief complaint. So start from the chief complaint, we will write some chief complaint that patient that enforce the patient to come to the hospital and to see the doctor, simply to seek the hospital care. So chief complaint can force the patient to come to the hospital. So chief complaint including pain, vomiting, diarrhea, fever, headache, dyspnea like shortness of breath, palpitation, and constipation, joint pain, seizure. So these are some common chief complaints that patient present to you. No one patient present only one chief complaint. Maybe if patient present with pain, so pain, fever, weight loss, they come like in a combination form and they present to you in your clinic. So this we call chief complaint. So today in this lecture I just talk briefly. Then history of presenting complaint. After that you will take the what's the history. Then the history you can just summarize or elaborate each symptom in a detail. So this is we call history. For example, pain, you can elaborate the pain, onset, duration, frequency, what's the radiation, what's the severity, aggravating, relieving factor. So this is we call the just to elaborate the symptom. After that there is a past medical history or past surgical history. So further past medical history and surgical history we will talk about in our next lecture. So till now I hope so you understand that how you take the history till now. So this is the basic format. So don't be so much anxiety, it's not very difficult, just practice. Okay, so I hope you guys you can understand. In our next lecture I will talk about further. Thank you.